Hi, I'm Rachel Wall, founder of Inspired Hygiene, and I am here with our coaching team. We have Kim Miller in Arizona, Amy Sanders in Charlotte, North Carolina, Amy Williford in Kentucky, and Jamie in Idaho Falls, Idaho. So we're all hygienists. We have the privilege of working together and working to help dental teams really elevate their hygiene services, systems, and profits, and really empower hygienists and help develop that really tight, great professional relationship between the dentist and the hygienist. And so we have had the opportunity to spend a lot of hours over the last 6 weeks with hundreds of dental professionals from coast to coast. And we'd love to share a few things that we have observed over that time. So one of our observations has been that team members, particularly dental hygienists, have been tending to fall into one of three categories, especially as we're looking into the reopening of dental practices. One category is the hygienists that are confident and ready to go back. And what we have found is that there is a direct correlation between those hygienists' confidence and willingness to go back and the preparedness of the leaders in their practice. So typically these hygienists are working in practices where there's a very clear plan for how they're going to reopen. There's been great communication all along throughout the closure, just about checking in with the team and how they're doing, but also like the PPE that's been gathered and what the clinical safety plan is going to be. The next category is the category of hygienists that are maybe nervous and hesitant. And hey, here's the thing, even those that are ready or confident, are probably going to be nervous on that first day, right? Things are going to be a little bit different. But there's this category of those that are hesitant, that are nervous, and maybe aren't quite ready to go back. And there are a lot of reasons for that. One is perhaps that hygienist has a medical reason for not going back, right? Perhaps he or she has some underlying medical issues, or somebody in their family has some underlying medical issues. Perhaps that individual hasn't had an opportunity to really talk with their doctor or their practice leader about the clinical safety plan, and still has some questions. But once those are answered, they're coming around, right? They're feeling more comfortable. Another reason might just be that they're just not quite ready, that they just don't feel like now is the time to go back to practice, and that's okay. And we're going to talk about some of the things that we can do if we fall into that category. So one thing is to be proactive and really reach out to your practice leader, whether that's the doctor or practice manager, whoever is in charge of really presenting this plan, and thinking to yourself, what do I need to feel safe? What do I need to feel confident going back and taking care of my patients? And then sharing some of that with that practice leader and asking them some questions. I don't quite understand maybe the PPE that you have in place. Can I ask a few questions and just get some clarity on some of that? And I think that helps a lot of folks really feel more comfortable. And that is what we have heard directly from dental professionals all over the country. The other piece that we know is if some folks aren't quite ready to go back, it's okay to express that too, to talk to the doctor and say, perhaps if your practice is having a soft opening and they're going to bring part of the team back in the first round, maybe you want to be in the second round, right? Maybe you want to learn from the experience of those team members that are maybe a little more eager than you are to get started. Or maybe you just express to your doctor, would it be okay if I hold out a couple more weeks? I understand that it's important for the practice to open so that we can share that we can care for our patients. But would it be okay if I hang back a couple weeks? And I'd love to hear your feedback on what's happening. Have that type of open communication with your doctor. The other reason why someone might be, or I'll say the other reason why we're hearing that some might be reluctant to go back is perhaps before COVID, there were some pretty obvious ocean infection control violations and things that just weren't in place. Or maybe there's some communication issues. And our advice to those folks has been to really evaluate whether that practice is the right place for them. And I think that's a fair thing to state. So those are the two categories we're seeing, the ones that are eager and ready to go back, those that are hesitant for a multitude of valid reasons. And then there's a third category. And the third category, unfortunately, has been one where dental professionals are exhibiting anger, hate, resentment, and it just makes us really sad. All those fears are coming together, right, in this kind of perfect storm. And we've even seen media outside of dentistry influencing and kind of stirring up these fears. So here's what we know. Our patients need us. And we have, over the last few weeks, had the opportunity to talk with our clients that we work with from all across the country. And what the dentists are telling us is that patients are presenting with urgent needs that could be avoided with therapeutic hygiene care. And so we believe that dental hygiene prevention and therapeutic care is essential. Doctors and nurses have been the first line of defense, and God bless them, they have gotten us so far here. And now dentistry is the next line of defense to help keep our patients healthy. Hygienists, we have been educating and preaching to our patients for decades on the importance of preventive and therapeutic care. We do love our patients. Preventive and therapeutic care, the importance of it and the impact that it has on their overall health. And that couldn't be more true now. So here's the thing. I feel that it is time for us to unite dentists and hygienists, dental assistants, dental business professionals, dental sales professionals, manufacturers, consultants, speakers, all of us. We must all unite in a positive way to present our profession and our industry to the community and the world as a whole. And what I know and what I feel and what I fear is that if we stay divided, we risk losing this profession that we have loved so much as hygienists, that we have put our hearts into. And I fear that our patients will not be able to receive the type of care that they need at this time. So we respect everybody's personal choice. We respect everyone's decision. And we also believe that dentistry is essential and that our patients need us to move forward, to be healthy, and for all of us to see the next great comeback of dentistry. Thank you so much for your time. We welcome your comments and your thoughts. And please feel free to reach out to us on social media and let's have a conversation. Thanks, everybody. Thanks, team, for being here.